Welcome to today's GNCC Espresso Live with our distinguished guest, the Acting Medical Officer of Health for Niagara Region, Dr. Hirji. Dr. Hirji, thank you so very much for being with us. My name is Mishka Balsam and I will be your moderator for the next hour. One of GNCC's guiding principles has been our commitment to being data-driven and evidence-based so that we as an organization can make well-informed decisions and hopefully assist organizations and individuals to do the same. It is with that in mind that we deeply appreciate having Dr. Hirji join us on a monthly basis for our Espresso Live. Organizations and governments are continuously responding to the ever-changing pandemic and its impact. Businesses have questions about the vaccination status, Ontario's announcements of proof of vaccination against COVID-19 to be implemented by next Wednesday, September the 22nd, and what is happening in schools and childcare settings around Niagara. And in our commitment to addressing your questions, our audience questions, we have shared many of your submissions with Dr. Hirji in advance so that some of it can be covered in his informative update, which is always the first part of the Espresso section. Following that, we are moving into the interactive Q&A session in the hope that we can answer all of your questions. And on that note, I am going to move the webinar over to Dr. Hirji for his overview.
Hey, thanks so much, Mishka, and thanks to the GNCC generally for inviting me to speak with you once again. As you said, I'll give a bit of an update, and one of the things I will do at the end, which I've done the last couple times, is give some key messages of what I think businesses and organizations should really be focused on to hopefully give something really practical to work on going forward. I just want to start today, though, by taking a step back and just, remembering why we need to do everything we're doing to prevent COVID-19. And if we go way, way back 18 months, back to March of 2020, these are some of the headlines that we are seeing. Italy, of course, one of the first countries in Italy that was hard hit, was seeing their hospitals overwhelmed. New York State, of course, was the area that was first hit in North America really badly, and likewise, they were seeing their hospitals overwhelmed. And I think the big reason why we've had to have so much disruption in our society was to try and avoid these kinds of scenarios where we'd see our hospitals overwhelmed. And I think, unfortunately, over the last few weeks, if we've been following the news, we've been seeing in other jurisdictions that some of these kinds of headlines are rearing their head again. And so this is a headline coming out of the United States a week or two ago, talking about how in these several states here, they are running out of ICU beds because there's so many people becoming severely ill with COVID-19 that need to be hospitalized. They're running out of beds for really anybody else. This is, I think, telling as well, states that have high vaccinations are maybe doing okay. Where they don't have high vaccinations, the other one-third of states, they are seeing themselves be overwhelmed with their COVID-19 patients. Another headline here about Texas, is running out of even staff to manage the patients who are in their ICUs. Of course, when there's all those people being hospitalized, I think it has a spillover effect on the population and people become very worried. And this was a headline of, last week, I believe, where you can see, Fox Business News here is saying that demand is slowing in the United States because people are so worried that they're seeing so many people around them becoming sick with COVID-19 being hospitalized that it's actually affecting economic growth. A few weeks ago, we saw, the stock market in the US take a bit of a dip out of concerns of what was happening with COVID-19. And of course, that's very relevant to everybody here where, we're trying to recover from the past 18 months. We're hoping to have an economic recovery. And if the pandemic gets out of control, this of course shows us, not just hospitals would be overwhelmed, but it could hamper our ability to recover economically. Those are the United States. And I just want to also now highlight what we're seeing in Alberta as an example right here in Canada of what's happening. And, we've seen headlines like this. This is about a week ago about hospital workers really worrying that hospitals near adding beds across the province to cope with the fourth wave, but workers to actually staff those beds is quite challenging. Here we can see, I see admissions slamming the hospital and the chief medical officer of health really regretting maybe some of the decisions the province made earlier to reopen too quickly. Healthcare workers there are starting, by the end of last week to warn that the health system was approaching collapse as COVID-19 cases would spiral out of control. And This was just a headline yesterday, where of course the province is saying that they are days from collapse. They are saying probably about 10 days away. So you're looking at the end of next week, and hence they're starting to introduce some rules. I worry, unfortunately, that it might be too little too late for them, and they may need to keep escalating those rules. Because the province is not going to have the workers to work in healthcare, they're starting to look to other provinces to see if they can get help with dealing with their surge of hospitalizations. But of course, other provinces aren't free of COVID-19. They're dealing with their own fourth waves. And you can see here BC saying that they don't have capacity to help Alberta out because they need all of their healthcare workers. And really the fallout of this leads to, some of these sorts of stories here. People's, surgeries are being canceled or suspended because they need to reallocate those staff to other issues. So people who might need to go into the hospital for removal of a cancer, for example, are seeing that kind of hospitalization delayed because they can't actually get that kind of care. In the US, they're talking about having to prioritize who can get to ICU beds, and actually Alberta is starting to say that they need to plan that as well. There's a story I saw earlier this week about an Alabama man who actually had a heart issue, nothing related to COVID, needed to get an ICU bed in hospital. And the hospital didn't have any beds. They called 43 other hospitals around them. None of those hospitals had any ICU beds for this person. And unfortunately, this individual ended up passing away because they, in part, couldn't get the hospital care that they needed. And then this is, hospitals running out of oxygen in some states. And then, one other quite sad story here, about what's going on in Alberta hospitals. This is Dr. Ryan Chowdhury, who's an ICU physician, saying that more and more younger patients are showing up in the hospital. Within a few hours, they need lots and lots of oxygen, and they need all kinds of invasive procedures. Talks about this man here who in his 40s had to be placed on a ventilator. Once you go on a ventilator, you need to be generally sedated because you're intubated, and if you're conscious while you have that tube down your throat, it's extremely uncomfortable and you basically feel like you're suffocating. And so you generally get sedated at that point. And before he got sedated, because there's a good chance he could pass away, he was asked if he wanted to see his parents, but his parents are seniors, they're old, he didn't want to expose them. And so unfortunately, he'd had to send a text message to his family before he went under, and might not have a chance to see them again. Lots of regret that hospital staff are saying. If many patients were saying that they now wish that they had been vaccinated because they now see how serious this illness is. And then this story here I saw earlier this week out of Edmonton, where an individual actually had a kind of cancer that was affecting his brain. Sorry, not his brain, sorry, his head. And he actually had a lot of his skin removed to the point that some of his skull was exposed. And he was going to the hospital to get a skin graft. He showed at the hospital, he was scrubbed in, but the hospital didn't have any ICU beds. And if his surgery doesn't go well, he would need to go to an ICU bed. So they couldn't go ahead with his surgery. And so, another story of someone who needed some pretty serious care, not able to get the care he needs because in Alberta, their hospital system is overwhelmed. And I think that's just a reminder of why we need to keep doing everything we're doing to make sure that we don't suffer those kinds of effects. Just to show you here that this is what Alberta's case curve looks like. And really, in start of July, they decided to lift all COVID precautions. And you can see quickly after that, they went on this upward trajectory, which has proceeded pretty much unabated. And they haven't done much until recently to address that. And unfortunately, it's going to be at least 2 or 3 weeks till we see any impact of what they've done. And I worry it's not enough at this point. So they could be in quite a bad state, easily exceeding their previous waves. And of course, we've just seen the headlines of what that's doing to their hospitals. On the flip side, though, I think, shifting now back closer to home, in Ontario, I think we did not completely reopen at the start of July. We took a slow phased approach to reopening. We never stopped physical distancing. We never stopped wearing masks. We've been a bit much more slow and cautious about reopening. And you can see what the impact of that is here, where our cases have not gone up the way Alberta's have. We've unfortunately seen our fourth wave go, but actually a bit of good news is over the last 10 days, cases in Ontario seem to have flattened out. And actually, if we take a look here at what's happened in Niagara, a bit noisier, but it's still the same pattern. Where over the last 10 days, our cases seem to actually have been flattening out. Now we take a look across a bunch of, our other public health jurisdictions across the province, particularly ones near us. Now this green line here is us in Niagara. You can see us going up. It's kind of in the middle of this week that we start to flatten out. Next week, if I plotted out, hopefully we would see that flattening very much show up that I showed you on the daily graph earlier. But you can see places like Hamilton, which was one of the highest areas of COVID-19, actually has come down. You have this purple line here, which is York Region. You have, I think, this black line, which is Peel Region. This is Middlesex, London here. A lot of parts of the province, you can see these lines have actually flattened out. And we're actually seeing a flattening really across the province. And that's actually meaning that we're deviating from what the Ontario Science Table was modeling would happen. So when they brought out their modeling a couple of weeks ago, we were on an upwards trajectory, and they're plotting that this is likely what that trajectory is going to end up looking like. If, however, people start to have more social contacts, and particularly if workplaces come back in person, schools go back, more people are socializing, we would probably shift onto this much steeper trajectory. If somehow people decrease transmission, which didn't seem likely, we could actually shift onto maybe a lower line like this. What we're actually seeing, midway through September is that we're still hovering under 1,000 cases. So we've actually ending up pretty similar to this green line. So there's some definite good news there. I don't have a great explanation for why we have ended up on that line. If we take a look at what's circulating in the province, it is absolutely still the Delta variant, that more difficult to control variant. So the virus hasn't suddenly become easier for us to control. Literally you can see confirmed Delta or suspected Delta, it makes up 100% of our cases in Niagara. If we're looking at the province, this is an index of how open your society is. As we've gone through, lockdowns, it goes up, and then we reopen, we come down. And as you can see, we've stayed as open as we have been really since the early part of July, much more open than we've been for a long time. And this orange line here is the mobility, how much people are out and about. And of course, with things open up, people are out and about more. There hasn't really been much of a change, maybe a little dip lately, but I think this might be updated, with more recent data show it hasn't changed much. So despite our level of activity in society being pretty flat, we nonetheless see our cases kind of flatten out, which I think wouldn't be expected. If there's enough interaction in society to drive cases up, we'd expect that to continue. And really, if you look at the breakdown here, you can see people maybe are staying home a touch more than they were. So maybe that's part of that explanation. But people, this is shopping and recreation. This is people on transit. Definitely people out and about more. Transit is probably up a bit because schools are back, and you can see, probably people are back into some workplaces as well. So that might be driving it. If we're looking at Niagara data, though, people staying home, much lower than it's been, but maybe it's ticked up a little bit over the last little while. So maybe that's the end of summer holidays. People are staying home a little bit more, and that's maybe what's explaining that slowdown in our cases. People being out and about doing shopping and recreation, we are at an all-time high, and maybe we've dipped down a little bit. So possibly that's part of the explanation. My best guess is maybe in August, people were enjoying the last bit of summer, they were taking vacations. And then as we've gotten into September, people have started to socialize a bit less. They're getting back into work and school routines. And that's meant that we've actually maybe been able to lower our interaction, decrease contacts with others, which has slowed the spread of infection for a little bit. I do worry that this flattening isn't going to be sustained. If we take a look at our Niagara case curve here, if we go back to last fall, we did see periods where we go up and we flatten, but then we go up again. We might be able to flatten it out for a bit, but the trend was we slowly kept going up, and eventually we did go past that tipping point that led into the second wave. And I do worry that might be what we are headed for. And if we take a look at other countries, such as the UK here, you can see, they were going upwards and they managed to, see things dip down a little bit before they went back on another upwards trend. The real world is not like the modeling in science where it just shows a nice clean upwards line. Things are going to be up and down a little bit. And I suspect that this flattening out may be temporary. It may not be sustained. But nonetheless, I think it is good news. It means that we are buying ourselves more time to do the things that are going to allow us to slow the spread of infection and hopefully keep ourselves in a state where we can keep this level of opening sustained over time. Just quickly showing you the reproductive number here in Ontario, you can see that after, through late July, August, where it's quite a bit above 1, it's now hovering closer to 1, which is consistent with things flattening out. And likewise here in Niagara, you can see we've seen it come back much closer to 1 of late, which is consistent with things flattening out. But of course, we're still near 1. It can easily flip back over above 1, and we could see those cases start to go up again. Now, of course, all of the cases, going up is one thing. What we're ultimately worried about is hospitalizations. We don't want to see our hospitals overwhelmed the way parts of the US and Alberta are. And this is what we're seeing in terms of our hospital trend. And you can see, while cases have flattened out, hospitals, the increase is slowed, but it isn't totally flat. It is still a small, slight increase. Likewise, if we're looking at people going into the ICU, it's much flatter, but it's maybe still a small, slight increase. So we're not out of the woods there yet, but of course, if we can keep it going at a slower pace, that means we have a much longer time to do things like get more people vaccinated. That'll ultimately get us out of this place of risk. This is in Niagara what we're seeing with hospitals and ICUs, and of course, we've gone up here, not quite as clean a line, just because we have it's much smaller numbers here, so it's a bit of a more noisier trend. So I think there is still hospitalizations going up a little bit. That's something we need to be mindful of. I also want to note that this month we've had 6 people unfortunately pass away from COVID-19, including one person who's in their 30s. So there's absolutely still human cost from the pandemic and where we are at that. And we obviously would like to try and keep cases as low as possible, so we make sure as much margin of safety to keep things open in society, and we decrease that human suffering. And I mentioned earlier that Alberta is looking for other provinces to help them out during this time of need. Because in Ontario we're doing so well, it's starting to look like Alberta patients might end up transferring over to our hospitals. And I think that's another reason that we want to make sure we keep things under control right now, so that we are able to help Alberta out and help some of our friends in Alberta who maybe need hospital care and can't get it there, that we'll hopefully have the capacity to do that going forward. Now, thinking about how we're going to keep cases under control, in the past, if you remember, when we've had cases go up, we've started to see restrictions in restaurants and banquet halls and in gyms and the like. Places where people tend to congregate, which aren't purely essential. We've started to see restrictions there to basically break up that social interaction so people aren't in contact with each other. And we basically starve the infection of the ability to spread, and that slows down the spread of infection. That's certainly an option that we could pursue again, but I think we are fortunately able, thanks to vaccination, able to do something a little bit differently. So if we take a look at, cases, hospitalizations, ICU beds in Ontario. If you're looking at the risk of someone who's fully vaccinated versus someone who's unvaccinated, this is the Ontario data, you can see the risk is far higher of being infected with COVID-19 if you're unvaccinated. You do the math here, this is probably about 7.5 times greater risk if you're unvaccinated that you're going to get infected with COVID-19. If you're looking at being hospitalized, this is, on the order of about 26 times or so higher risk of being hospitalized. Getting into an ICU, you're looking at, probably, 30, 40 times higher risk if you're unvaccinated than you're fully vaccinated. Looking at the national data, they show very similar pattern here with unvaccinated risk much higher than fully vaccinated. 12 times higher in an unvaccinated person to be a case. 36 times higher risk to be hospitalized if you're unvaccinated. And then in Niagara, we've been putting out this kind of data as well. If you're unvaccinated, your risk is 7.5 times higher that you're going to be a case of COVID-19. And just to quickly show you the calculation here for hospitalizations, it ends up being just under 11 times more likely that you've been hospitalized in the last 28 days if you're unvaccinated than you're fully vaccinated. And I think that is the basis here of the vaccination requirement the province is bringing in. That rather than putting restrictions universally on restaurants, on nightclubs, meeting spaces, gyms, sporting events, concert venues, etc., what we're doing is we're seeing the restrictions put on the people where the risk of spread of infection is, which is unvaccinated people. So instead of closing restaurants, we're only closing it to the unvaccinated people. The 80+% of adults who are fully vaccinated, will still be able to use these. And that will hopefully address the risk of infection spreading by breaking up the social interaction amongst unvaccinated people where the vast majority of infection is spreading, while not necessarily harming these businesses very much, so we can continue with the economic recovery. And a lot of people think about this proof of vaccination requirements to get vaccine rates up. I hope it has that side effect, but I don't think that's a primary reason. I think this is the new way of looking at COVID restrictions. Instead of COVID restrictions applying to everybody and applying to businesses universally, it's now only applying to unvaccinated people because that's where the risk is. Ultimately, though, hopefully we do see more people get vaccinated because I think that is going to be the ultimate end game to this pandemic. I've shown this data before that if we are, this is national data, showing that if we got 79% of eligible people vaccinated, we would see a hospital curve like this in the country overall. This black line is kind of the average of scenarios. All of these gray lines are different scenarios that could play out. And you can see there's lots of scenarios that are above this dotted red line, which is the hospital capacity of the country. Some provinces like Alberta, of course, are already getting to the point where they're about to exceed it. We in Ontario, fortunately, are much lower. But the aggregate would be that we would see something like this. And maybe not quite 50% of scenarios, but a good proportion of scenarios are that we would exceed the hospital capacity of the country, and we would not be able to care for all the people who need hospital care. If you move from 79% of people, eligible people fully vaccinated to 83%, you see that that line drops quite a bit, that average scenario. And actually, most of your scenarios, almost all of them, are now below the hospital capacity of the country. Now that should be noted that this scenario, this average of the scenarios, is still worse than any of our previous waves. So this would still be quite onerous on our healthcare system. Of course, with this many hospitalizations, we would sadly see people dying. We would have lots and lots of cases in the community. I worry that things like schools would be quite disrupted, but we wouldn't need to have a lockdown to stop the spread of infections because we wouldn't be looking at our hospitals being completely overwhelmed. But I could see something like schools unfortunately needing to be closed because there'll be so many cases there. And we would need to be relying on, a lot of our ongoing measures like mass physical distance, etc. And we would be seeing the human costs in our society. So that 83% of fully vaccinated, I think, gets us to the state where we are past the most danger. But of course, we want to keep vaccinating people so we can get this line lower and lower, lower the risk of the human cost of the pandemic, and really get ourselves to something much safer. So 83% is that number of eligible people fully vaccinated that I've been talking about that the federal government data has been showing. Just showing this slide from the latest modeling released from the Ontario Science Table. And I just want to zero in here where they talk about 85% of the eligible population fully vaccinated. So, the Ontario Science Table is 85%, a touch higher than that 83%. So that's, I think, a first kind of metric we want to be shooting for, that 83 to 85% of people fully vaccinated, but then hopefully, of course, trying to get it even higher than that. And if we take a look at our current vaccine uptake in Niagara, these orange lines are first doses. And if we're looking at our eligible residents, we're at 83.7. So we've got our first doses actually into that 83 to 85% range. Now, we need to get the people fully vaccinated to that level. And if we look at the fully vaccinated number, it's closer to 77%. So there's a bit more work to get those first dose people back for their second dose. The good news is we have their contact information in most cases. And we're actually just planning to do another round of sending contacts out to some of these people who are eligible for their second dose who haven't yet got it, so we can hopefully narrow that gap more. But there's some positive news here that we've got partway to meeting that 83 to 85% margin. We've got our first doses there. We just need to get the second doses up. The province is talking now about they want to get to 90% first and second doses as their level where they feel there would be a greater margin of safety, and of course we would decrease the human cost. And so once we get the fully vaccinated number to 83%, we want to keep working to maybe get it up to 90%. If you look just quickly at our age groups, of course, our elderly groups are where we're, of course, seeing people highly vaccinated. 60 years and up, we're over 90% of every age group is fully vaccinated and approaching 100% actually in some of them. A bit below that, we're, of course, not doing quite as well, but making progress. And then our youngest age groups is where there's the most room to see those vaccine uptake numbers go up. And I just want to show you actually how this is playing out in terms of our fourth wave. So the 60-year-olds and up are very highly vaccinated. if we take a look at the age breakdown of our cases, this is our second wave here, our third wave, this is our current wave. If you're looking at the blue line of 60 and up and the green line of 80 and up, you're not really seeing these numbers as high as for other age groups. And I think that's a direct consequence that these age groups are already over 90% fully vaccinated. These age groups where you have lower vaccine uptake, you're seeing a lot higher spread of infection. And particularly this 20 to 39 age group, which is where our vaccine uptake is the lowest, you can see has the highest spread of infections. And so the vaccine is ultimately really what is determining what our spread of infection looks like. Last thing I just want to dive into is, what does it look like if we dive a little bit beyond just ages, but sort of where are some of these cases coming from? And I'm just going to show you a breakdown of where our cases linked to outbreaks in Niagara have been really since the start of August. So literally looking at the last 6 weeks. So a big thing I think you can see here is that most of our cases are actually out in the community, 80%. Only a minority of cases are actually linked to outbreaks. But where we see outbreaks, I think it is fairly significant. So this, gray bar here is a bit of a larger pie. That's healthcare facilities. We of course expect that's going to be an area where we're going to see outbreaks. Farms, another area where we see constantly outbreaks, so that's quite high. The unfortunate one here is food services industry, and I know we've seen that in past waves be a risk area. We are unfortunately seeing that that's the one other area where we're seeing a bit of concentration of outbreaks. Diving in then just on these outbreak cases and actually just looking at the pure number of facilities that have had outbreaks, it looks kind of like this. Now, what's interesting here is you see this 32%. These are actually outbreaks outside of Niagara. So people are working in, attending, visiting some facility outside of Niagara that unfortunately ends up in outbreak, and we end up with some cases linked to that. Usually it's only one case for any of those outbreaks. So there's a large number of outbreaks where we have one person attributed to it. So that means there's a lot of outbreaks here, but fortunately not that many cases. But if you're looking at what are the big slices of pie here, food service industry is the biggest slice of the pie, followed here by workplaces. Honorable mention then would be congregate settings, the education sector here, social settings where people might congregate. But I really want to focus in on this food service sector because, of course, that's, I think, an area of great concern. It's a really important part of our sector. For the most part, I would say on the order of 75, 80% of these cases have actually been staff. They have not been the patrons visiting this. So these are almost largely more food service workplace outbreaks than community outbreaks or outbreaks amongst the patrons. And likewise, we have outbreaks among many of our other workplaces. And so I think a priority for us is to really see if we can try and tamp down the spread of infection among employees and workers, because I think that's going to give us some more margin of safety to keep cases hopefully lower and buy ourselves more and more time to get vaccinations up. And just highlight some of the things that I think are really important for keeping workplaces safe. Consistent pattern in the workplaces we've seen outbreaks is vaccination uptake is low. And so if you're in a workplace, I think there's very good reason for you to think about having some sort of vaccination policy to try and get those vaccine rates up. The softest policy you could create would be simply that you're going to actively endorse, support vaccination. You're going to try and convince your employees. You're going to have executive level communication to encourage employees to get vaccinated. You're going to give employees time off that they can go get vaccinated during work time to minimize any barriers. And that will hopefully have some effect on getting vaccine rates up. Other would be that you have some sort of disclosure policy, so people maybe feel embarrassed and go get vaccinated because they don't want to disclose that they aren't vaccinated. And of course, then you could go to actually requiring vaccination, which the province has required in some settings. And we can't rule out might happen in other settings. Halton Region has actually required any employer with more than 100 workers to actually have a mandatory vaccination policy. We aren't doing that yet here in Niagara, but I would definitely encourage all workplaces to think about what makes sense as a workplace vaccination policy for them to try and get those vaccination rates up so that you have as few unvaccinated workers, which means you're unlikely to get an outbreak. Daily screening of people every day to make sure symptomatic people aren't coming to the workplace is absolutely key. One thing we've seen in some of the workplaces where we've seen outbreaks is that symptomatic people have been in the workplace. And if you have good screening of symptomatic people, you can hopefully keep them out. I know the Chamber is also helping distribute rapid antigen testing. And I think this can be a good adjunct to daily screening where you don't have any symptoms, you now do the rapid antigen test, and it's going to pick up some of the asymptomatic people who might actually be infected and coming into the workplace. Should note that rapid antigen testing is not perfect. It's not, the recommended test if you have symptoms of illness. But for someone who has no symptoms of illness, I think it can be an additional measure that gives you even greater margin of safety to make sure you're not letting someone with symptoms into the workplace. If we do have someone symptomatic in the workplace, you absolutely want to isolate them right away. So send them home and have them get tested, and hopefully have sick policies so people who are sick don't feel compelled to maybe lie on their screening and not isolate and actually show up to work because they really feel they desperately need that income. We see a lot of service level workers, which I think is perhaps why we see staff outbreaks in food service industries, is because people there aren't paid terribly well and they might be really desperate to get their income. And so we can support them that they're going to not have to worry about income. So they do the right thing of staying home, getting tested, and make sure they don't harm the workplace. I think that is going to really keep workplaces safe. And so I'd encourage to have sick policies for the workplace to really support workers to be honest about their symptom screening, to stay home when they're sick, and make sure they get tested so that we can stop those workplace outbreaks. Of course, keeping physical distance is really important. You can see in this graphic here that the droplets a person breathes out, fall to the ground. There's finer aerosols which will float in the air, but they're going to be more concentrated near to a person, and they sort of dissipate as you get farther away because they just kind of spread out as you go, and the risk to others is less. So keeping people physically distanced on the job as much as possible is very important. Small enclosed places like vehicles, that's a place where people can't keep distance, where aerosol can build up. So try and keep people in separate vehicles so they're not riding together. If they absolutely must ride together, keep the windows open to vent out any aerosol from building up in there, and make sure people are wearing masks and ideally some sort of eye protection as well, because both of those will protect them from these droplets and aerosols infecting them. On that note, masks required in really any indoor space where people are working. If you're working within 2 meters of others and you can't keep distance, you really should have eye protection. And lots of businesses, if they're serving the public and coming within 2 meters of the public, it's actually a provincial requirement that you are wearing eye protection. So for example, in restaurants, people serving patrons really should be wearing eye protection. So absolutely make sure people have the personal protective equipment that they need to be in the workplace to slow the spread of infection. Make sure they're using it properly. So a mask, you want to make sure you mold it around the face to make sure there's no gaps. If there's gaps, of course, aerosol virus is going to leak outside of that and potentially still infect others. So you want to make sure that mask has good coverage, covering both the nose and mouth. And with eye protection, whether it's goggles or face shield, you do want to periodically disinfect it. So, you've worked 3 hours, you're going off on your break. That's the time to pull out some disinfectant wipe down that eye protection to make sure that if you have come in contact with any virus through the course of work, you make sure to disinfect it the next time you pick it up to put it back on so you're not potentially infecting yourself. Breaks in break rooms, of course, people are going to stop to have their coffee, they're going to have their lunch. That tends to be, of course, where people no longer have their masks on, so that's going to create a potential infection to spread. So as much as possible, if you can have no break rooms and send people away, ideally outdoors to have their breaks, that's going to limit the spread of infection. If you do have a break, room, make sure you space people out as much as possible, have good ventilation, keep windows open to decrease the risk of that. Ventilation and filtration is really important to get these fine aerosols out of the air. Make sure you've got your HVAC system, ventilation system running all the time to make sure you're circulating that air and exchanging with the outside air. So any aerosol doesn't build up, it's getting sent to the outside. And try to have as good a filter as possible in that HVAC system. Ideally a MERV 13 or higher filter, because that's going to actually remove the virus from the air and keep things safer. And then finally, province requires a workplace safety plan, and we do find that a lot of our workplaces that have outbreaks often don't have that workplace safety plan in place. And if you put that workplace safety plan in place, that'll actually prompt you to get a lot of these other things done. So if you don't have one of those, please get that done. I think that's another thing that's going to keep workplaces safe. We're planning actually next week that we're going to do a very public communication to the community as a whole to really encourage workplaces to do that so that we can keep our workplaces as safe as possible and make sure workplaces aren't disrupted from operating because they have outbreaks, because they have sick employees. And of course, we keep infection as low as possible by taking workplace off the table as a place where we're going to see spread of infection. So I hope that is some useful information, and I'll stop there and let's turn over to deal with some of the questions.
Dr. Hirji, thank you so very much for the update. I have to say, month after month, it's really appreciated. And it's also really appreciated to seeing this latest up-to-date information. It makes me feel fortunate to live in Ontario and Niagara, especially when we look at some of the numbers that we see in our sister province, Alberta, or south of the border in Texas and other areas of it. So I think it gives us a perspective of what is happening, not just in our community, but across our country, and where we also can hopefully assist those most in need of it. So thank you for the update of it. There have been a high number of questions that have come forward, and a few questions that also have come in during the last couple of minutes via chat function. I want to encourage everyone, if you do have a question that you would like us to ask in the next half hour that we have, we're more than committed to getting to all of them. And on that note, I think maybe it's a good time to jump in. So from business and organizations, we have heard a lot regarding the province's announcement on the new guidelines to implement a vaccination status check. You've addressed it, you spoke about in your update in the effectiveness and the need for it that is there. But at the same time, often what we have seen, the province has announced something and then a week later, 2 weeks later, there are potential pitfalls with the program or opportunities on how to improve it. And business like to have a little bit of advance notice. So when you looked at the guidelines that have been announced, can business expect to see further changes to it? Do you see potential pitfalls of the program that business hopefully maybe can prepare ahead of time?
Yeah, so, I think the two pitfalls that I see is, first off, that there's going to be someone who needs to be at the front of the business really checking people's vaccination status. And, I can think of a restaurant or somewhere like that where it's often, a young student, young person who actually is unfortunately on the front line. And there's unfortunately going to be some angry people who you need to turn away. And that's going to be a difficult job for that person. So I think if we can give them the training, the support, and have someone there to help them out when they encounter those difficult situations, I think that would hopefully make it a bit more smoother, at least in the first few days where likely some people are going to be surprised by this requirement, and we hopefully support them. The other challenge I see for those groups is really interpreting vaccination records. The province has announced on October 22nd, we're going to have that nice QR code where you can scan. It's going to say if someone is eligible or not. Prior to that, unfortunately, that person at the front is going to have to interpret vaccination records. Now, if you get the Ontario vaccination record, it does conveniently say at the bottom there that, this person has 2 doses and fully vaccinated. So you can look for that line if they've gotten both their doses in Ontario. That starts to be messy if they got 1 dose in another province, the 2nd dose in Ontario, or vice versa, or they got vaccinated as a snowbird, say in the US, and they're bringing US records, and you need to kind of try and interpret those records. And I see that as being a bit of a challenge in some cases. I don't have great advice on how to deal with it. If you can maybe have some, tips or pointers, and we'll think about maybe getting some of that up on our website. I think that might be helpful for that person up front who has to deal with that. And similarly, if they have a medical exemption, that person has to kind of interpret that medical exemption. They'll be seeing notes written by doctors and the like, and trying to interpret whether or not that's okay. And I see that as a bit of a challenge. So, I think it's going to become a lot cleaner on October 22nd when we have a QR code and you just scan that, it's going to say yes or no. But until then, there's unfortunately going to be that difficult job of interpreting records.
And we hear the same feedback actually from our businesses too. They're highly concerned about that aspect of it, but committed to the process nevertheless. I actually, at this point in time, I would also like to share in our chat function, there is a document that came out by the Ontario Ministry of Health that really addresses a lot of the questions and that businesses have, really more finite of what it means to them, what to look for. And hopefully that document actually will assist you, our attendees in particular, participants of today's webinar to train some of your staff and things specifically look for, things to ask for, and what does it mean when someone is coming to your premise and then goes into a different department of yours, or takes advantage of a restaurant here but has entered the hotel here and wants to use the pool in an hour from now. These are really questions that a lot of businesses have, and we hope that this follow-up document is helpful. It is also available on our site too, but we'll share it right here. The other question that we have heard from is that, or I've seen in news reports that have come out, is that earlier on Thursday, yesterday, Ontario's publicly funded school boards reported more than 100 new COVID-19 cases among staff and students, as the total number of active infections actually surpasses 500. And so we're starting to see some of that in Niagara as well. And quite a few people have reached out to us to ask you the question, if you can give us an overview of what is happening so early on in the new school year here in Niagara.
Yeah, so, I think as of this morning, we're up to, I think, 17 or 18 schools that have a case in Niagara. The good news is that almost all the schools have one case. So, of those 17, 18 schools, I think it comes up to about, 20, 21 cases total. What we're seeing is it's not spread within schools because there's only one case. So there's only one person who's infected. They've unfortunately been infected usually from their parents or someone else at home, and then showed up to school when they had infection. And so this is really a reflection that the spread we're seeing in the community is going to then show up in schools. The lower you have cases in the community, the fewer kids are going to be getting sick at home, fewer staff are going to be showing up to school with infection, and we're going to be able to bring that down. And our hope is that with the vaccine certification requirement, that'll hopefully help, that this plateau maybe is something we can at least bring down for a little while, and that's going to give us more margin of safety for schools. But this is really a reflection right now of the spread in the community is showing up in kids or staff who are coming to school, and we're having an initial case. And we've fortunately been able to stop spread from that point onwards thus far, and hopefully that'll be able to continue.
Yeah, and I think the hope is with the parents as well who are here. I want to get to a couple of the questions that have come in via the chat. One of them is from Melissa, and she is wondering if we can discuss options for those of individuals who've had the AstraZeneca as the first dose and then Pfizer or Moderna as the second. Will they be able to get a second dose of Pfizer or Moderna anytime soon? And how does it impact them in other measurements that even internationally have been put in place?
Yeah, so there is no plan I've heard for that to happen in Ontario yet. The early data we saw coming out of the UK and Spain is actually to get that combination of AstraZeneca and then Pfizer or Moderna seems to actually give you better protection getting 2 doses of Pfizer, 2 doses of Moderna. So from a need for another dose to protect yourself, it doesn't really seem the data supports that. You'd be considered fully vaccinated for the purposes of the vaccine certification. The place where I see it is going to be a little difficult would be for the purposes of travel. And so, as much as possible, if you can maybe, if you need to travel, get a doctor's note, affirming that you are fully vaccinated to travel, that would be, hopefully helpful. I know the US isn't really looking at vaccination requirements for travel, so it's not a barrier for that travel. I do note, though, Canada does still have a travel advisory that's discouraging travel internationally and really limiting your travel to those that are, essential, visiting, ill family, for example, for the purpose of conducting business. So for the most part, hopefully people aren't going to be traveling and aren't going to need this, but absolutely for those who do need to show proof of vaccination, I think that mixed schedule does become a little bit complicated in those cases. And hopefully a note from your doctor will help you navigate that.
Very good. Thank you for that. And this has been a question that has also in previous Espressos actually come up. So I think it's good for us to follow up on it. There's another question that has come in via the chat, and this is specifically related to the testing in Niagara and the experience that it has slowed down. And sometimes their own staff are waiting for almost 2 days for getting a testing spot in our community. And some of them have been encouraged to drive to Hamilton for a quicker test. And it's kind of discouraging employees at the same time to disclose that they have symptoms because of the delay. And probably sometimes also likely it's discouraging for employers to support employees at the same time. And I was wondering if you could comment on that delay that employers and employees are experiencing.
Yeah, no, this has definitely been a concern for us in public health, because this also means that we can identify if someone is infected with COVID-19 and do contact tracing and all those other important things that are slow the spread of infection. This is something we've actually been highlighting to the province since really mid-August, that we needed to get assessment centers back up and running. The province had a bit of a policy that they took over the summer to scale down assessment centers and try to shift testing over to the primary care. We saw the assessment centers kind of reduce in number and slow down, but we didn't really see as much pickup from primary care to make up that. We're trying to work with Niagara Health right now to see about options to get assessment centers back up and running. And we're actually also talking to our primary care community to see if we can have them maybe even staff another assessment center, or maybe do more testing on the community to build that up, because I absolutely agree this is a problem. One of the challenges I know Niagara Health is feeling about getting assessment centers up and running is actually their staff is quite limited right now. Unfortunately, we've seen after the second and third wave, a lot of healthcare workers actually left the profession, just given the burnout of that. And so Niagara Health is actually struggling to fully staff right now, and that's making it more difficult for them to start up additional assessment centers and scale that up. But we're hopefully working on some plans, and we'll hopefully get this a bit better in the coming weeks.
Dr. Hirji, in the meantime, are you recommending that people should drive up to Hamilton and or to a neighboring health facility to get the test?
If you're able to get the test more quickly there, yeah, I would certainly think that's fine. You're obviously hopefully driving alone, so you're not, exposing anybody to illness, so it's going to be safe. And the faster you get that test result, of course, the better for you, the better for your employer, and the better for our work in public health.
Very good. There have been a lot of questions coming forward regarding providing a third dose of the COVID-19 vaccine to a wider list of people after the provincial government expanded its eligibility list over the last couple of weeks. In the third dose program started at the beginning of September of this month and is initially aimed at older people living in congregate settings like nursing homes and others. Who are probably considered to be more medically vulnerable. Can you give us your take on that third dose? We've asked you nearly each and every month about this, but it seems to be there's movement in the thought around this one, and we see this in the decisions that have been made at the provincial level as well. So we would like your take on it.
Sure. Yeah. So, when we think about the groups who are getting the third dose, as you said, they're older, more medically vulnerable. And I think actually the key element there is they have weaker immune systems. And part of that weaker immune system is that they don't respond to a vaccine as well. They're not going to get that same level of immunity from vaccination. And we actually have a long history of vaccines where when someone has a weak immune system, we actually do give additional doses of vaccine, and giving more doses of vaccine actually gets people to the same level of immunity. Just to take one example, the HPV vaccine which children get in schools, is a 2-dose vaccine, but it's a 3-dose vaccine if a child has immune issues. They have a medical condition that weakens their immune system. And so that's kind of analogous to what's happening here. We're giving a third dose to people who have that weak immune system because we think they need that third dose to actually get the same level of immunity that the rest of us got with that second dose. In terms of doing a broad third dose program, I know the US announced it, and it supposedly was going to start Friday, and actually as of this morning at least, the FDA is still not actually given the go-ahead to doing that third dose. So it was sort of a political announcement without necessarily having the scientific backing for it. My perspective is that I think it's a mistake to go down the third dose line. I don't think the science strongly supports it. Yes, there is some weakening of immunity over time that happens with all vaccines, but it's still showing, really good safety that people are getting, especially when it comes to hospitalizations and death, where we're seeing almost no weakening of their benefit. The other part is, I showed the risk of where infection is spreading. 70% plus of our infection is in unvaccinated people. 20% or so is in the fully vaccinated people, and then 10% is the partly vaccinated people. So should we focus on doubling down and reducing risk on 20% of our cases by giving them that third dose? Or do we focus on getting that 70% who have no doses and the 10% additional who have only 1 dose to get them there up to the level of having 2 doses? And I think that's where we need to keep our focus. That's where most of the spread of infection is. That's where most of the risk is. And that's what's really going to get us to a sustainable level of safety. If everybody had 2 doses of vaccine, we would largely be past the pandemic at this point. It's the fact that we have a 25+% of the population who still has no doses. That's where all the risk is. And so I think we strategically want to focus where that risk is, which is the unvaccinated people, and focusing on third doses for the fully vaccinated is really distracting ourselves where the problem really doesn't exist. The other issue, very quickly, which I've mentioned in the past, is variants are emerging in other countries where infection is spreading uncontrollably, and we really need to vaccinate them so we don't have any new variant that comes here and starts to threaten us as well.
Yeah, and actually that ties into a question that has come forward too, is if you could comment on any new variants that you're hearing about, that you're seeing, and that might be of a concern.
Yeah, the one new variant that has come up lately is the Mu variant in South America. Thus, the concern around that variant is largely it has some mutations that might make it more resistant to the vaccine. But thus far, it seems like a variant that doesn't spread as easily as the Delta variant. And part of the good part of the Delta variant is that because it's just spread so quickly and is so difficult to control, it basically has crowded out any other variant. And it looks most likely that if the Mu variant came here, it wouldn't be able to compete with the Delta variant, and the Delta variant would basically just crowd it out again. And fortunately, the vaccine does still work pretty well against the Delta variant.
Thank you very much for that. In August, we talked about the upcoming election, and we talked about just procedures of, town hall meetings, candidates meetings, and so on. But we also talked about election day, which is on Monday. The federal government at the time had anticipated that more people would mail in their votes than actually the results so far have shown. So which means it is our hope that people will go to the polls, that they do want to exercise, but at the same time, voters want to feel safe as they're going to the polls. Can you give us your sense of it, and for those people who are here with us on the call, to saying that it is safe to move forward, because we do want to make sure that people exercise their democratic right at the same time?
Yeah, absolutely. So, I mailed my ballot off Wednesday morning. So if anybody did request those mail ballots, do get them in right away, because I think Elections Canada needs to receive them by Monday. If you are going to vote in person, I think advanced polls may have closed at this point. So that's not going to be an option anymore. So you'll likely be voting on Monday. What I'd recommend is try to go at a time when it seems the polling station isn't very busy. The fewer people around, the less risk there's going to be. When you do go to the polling station, keep your 2 meters distance, wear your mask. That's going to be the general thing that keeps you safe. Fortunately, a polling station isn't a place where you're going to socialize with others, which is the higher risk activity. If you're staying 2 meters apart, wearing your mask, it should be pretty safe for you. One other thing is I think Elections Canada is encouraging that you bring your own pencil with you, because they don't want to have people reusing pencils at the polling station. So bring your own pencil with you so you can use it. And if you don't, I believe they actually have pencils there that you dispose of after using one. So that's a bit wasteful. So ideally, hopefully you can bring your own pencil.
Thank you very much. There are a couple of questions, or a couple of businesses who brought forward the question about the new, again, we're coming back to the vaccine certification process. And they're asking if this is a temporary situation that they're in, and that we can, and when can they anticipate that these limitations will also be lifted. And when the Ontario government initially announced it, they actually referred to it as being a temporary one, not a permanent measure. Can you give people kind of an update in the sense of, is this a permanent aspect that we need to or anticipate to be in place for longer than 6 months to 12 months to 18 months, or is this really just temporary?
I think it's temporary, but temporary might mean on the order of 8 to 9 months potentially. Going back, the way I see this is the way we've done restrictions on the businesses in the past to reduce social interaction and bring cases down. This is just a new form of doing that, which is less economically painful. Once cases get to a low level, we would no longer need this. And cases will eventually get to a low level once pretty much everybody has some level of immunity, either because they've been vaccinated or they've become infected with COVID-19. And so, over the next 6-9 months, we'll hopefully get vaccinations much higher. We'll get a vaccine for the 5 to 11-year-olds, so a lot of children will get vaccinated. And that'll get to us to a stage where there's hopefully enough immunity out there that we can't see surges of hospitalizations that overwhelm our healthcare system. We can kind of endure it. At that stage, we probably don't need it as well. need the certification anymore. If we do see, vaccination rates don't go quite as high, the infection is going to keep spreading more and more, and vaccinated people will get sick and will get immunity by virtue of having sick and getting better, hopefully. And that'll mean that we'll get that immunity some way as well. So, I see it's probably a measure that likely stays in some form for 6 to 9 months. I could see it maybe expanding to other settings. Maybe it shifts in times that maybe, we reduce it in some settings as we get cases in the pandemic more under control. But I think it's unlikely to last beyond next summer.
Yeah. Thank you very much. There's a question that has also been submitted to us, and it's that this new data tracking system, will it be required by school boards as well? Could it be effective to be implemented in school boards?
I assume for the vaccine certification, yes. That's what they mean. Yeah, it potentially could be, I guess, at the secondary school level. At the elementary school level, of course, the vast majority of children right now are not eligible to be vaccinated. And so you're going to have a large number of unvaccinated children in school. I suppose you could do it at the secondary school level where most children would be old enough to be vaccinated, and you could maybe limit schools to just fully vaccinated students. I think we would see schools as essential. So just like vaccine certification doesn't apply to going to the grocery store or going to a healthcare facility because those are essential, I think we'd probably see schools at the same sort of level and be quite loath to require vaccine certification in schools. That being said, if we're getting to the point where we had to close schools in past waves, maybe that is what you do before you take that step of closing schools, that you would require vaccine certification. So I think it's possible. I think we would be unlikely to see it, but maybe it would happen if we were getting to a point where spread in secondary school is out of control and we were considering closing schools.
Thank you. Quite a high number of employers, not only in Niagara, but across Ontario, have had really hard time encouraging employees to come back to their place of employment. And that has been a huge challenge that is there. When we look at your numbers, 16% of outbreaks are in food service related ones, the other 10% then in workplaces. When we look at 16%, when we look at 10%, can you quantify that further to us? Because percentages are relevant, but it's only when we really know the 16% represent 5 places, or does it represent 500 places?
Yeah, so with the food services, I believe it was 7 total over those 6 weeks. And then with the workplaces, I think it's about 4 additional workplaces are there. So that's the kind of numbers we're looking at. So fortunately, not overwhelming, but enough that it's caused, part of what's driving spread in the community. And for those workplaces who do have an outbreak, that's quite disruptive to them.
Yeah, I agree with you, and we've heard the same. It's very difficult to manage, but I think it's also good for us to quantify it on that level, to also know that so many employers have put the right measurements in place and the guidelines in place and are more than committed to actually keeping employees safe at all times. So I think this is good. This hour always goes by so quickly. So we're at the top of the hour. Dr. Hirji, any closing comments you would like to make before we wrap up this espresso?
Yeah, I think it's really encouraging that we've seen a bit of flattening of cases. I think the pandemic is quite difficult. I know a lot of the businesses here are paying additional to do screening, to do additional cleaning, to practice these COVID precautions. And I think this is some positive reinforcement that what we are doing is working. It's not for nothing. We're seeing the opposite of what happens in a place like Alberta, and we've avoided that thanks to everybody's hard work and dedication. So let's keep that up as much as possible. And then those comments I made at the end around what additional things we can make sure we have in our workplace to make sure we keep our workplaces as safe as possible, that's one more thing we can do. And of course, finally, encouraging people to get vaccinated using whatever avenues we do, that's going to be what ultimately gets us out of this pandemic.
Yeah, Dr. Hirji, as always, it's a pleasure actually spending this hour with you. And on behalf of all of our participants here, thank you for being with us. This webinar has been recorded and will be available on our website at gncc.ca, and it will also be emailed to all of our webinar participants directly. So thank you. If you are looking or have questions on how to keep your workplace safe or how the new measurements and guidelines are impacting your business, please let us know. Reach out to us at info@gnccc.ca. gncc.ca or to me directly at mishka@gncc.ca. We're here to help you. We're here to keep the community safe. So thank you for that. And I wish all of you a wonderful weekend.
Thank you.